Rob Spangler here for 97.7 Country, WGLR, and we are joined in studio by Dr. Erin Kennedy from Dubuque. Good morning, Dr. Kennedy.
Good morning. How are you?
I'm doing good. Thanks for stopping by. So we want to talk about something with plastic surgery called the off-season. This is something I know you coined in your office. Maybe you not.
I gotta say, we didn't particularly coin it, but
yeah.
We've taken it over.
But tell us about what that concept means as far as the off-season when it comes to plastic surgery and the procedures you do.
We sort of think of the off-season as we're between seasons. It's a tweener because we're not in summer where you're out at boating and you're out at ball games and you're on the river, but you're not into the holidays and family pictures and running to get everything ready for Thanksgiving and all the other events that you have going on. So this is a little bit of a lull in your social schedule, and so this is a perfect time that if you need to take a week out so that you can have maybe some recovery, you may have some bruising, you may have some swelling, you may need to not necessarily be around people, and so this is the perfect time to sort of think back of, what was I not terribly happy with over the summer that I might want to address before the Christmas pictures. That did all my selfies or all my pictures over the summer have angry lines in my face, or did my lips really look all wrinkled and everything, or was I unhappy with my breasts or my tummy or my thighs, and that this might be the time to address them before you get into Christmas pictures and things start showing back up.
Dr. Erin Kennedy joining us here in studio on WGLR. And Dr. Kennedy, when it comes to that off-season that you're talking about and the procedures, what are some of the specific procedures? I know some people get sun damage actually during the summer months, and so this time of the year, lasers, that's a popular treatment, isn't it?
It is, and it's a perfect thing to do in the off-season because you don't want to do lasers when there's a lot of sun exposure because that can have its own problems or risks if you do it during sun time. And so doing it now when you're not going to go right back out on the river to the ball fields, and then you can treat it. You can get rid of normal aging can cause some thinning of the skin, some lines and wrinkles. The sun can cause freckles, age spots, just some other damage, and doesn't make your skin look so fresh. Rosacea and things like that can cause some redness, small blood vessels, and so lasers can be used to reduce the browns, reduce the reds, make your tone and texture of your skin better, reduce the small wrinkles, deeper wrinkles of your face, your neck, your décolletage, and chest. And so this time of year is just a great time to address that. If you were tired of shaving, this is a good time to do hair reduction laser for your armpits or your bikini line, so that when you get back into next summer, or swimsuits next summer, that you've addressed some of those issues. And so this is an awesome time for laser because then you have time to do whatever number of treatments are necessary to really get you where you want to be.
Dr. Kennedy joining us again. On top of lasers, you talk about maybe liposuction, which is a little bit more invasive, Coolsculpting, which is not invasive, but both of those treatments are good this time of the year. As you said, if you're trying to on those jeans again after summer, not quite fitting, those are some options. And again, talking about the more invasive stuff like, say, liposuction, this is a time where you can wear sweatshirts and things and kind of cover up some of the post-surgery body, if you will, after something like that, right?
Absolutely, and those are something that people will say, gosh, my jeans don't fit this fall the way that they did in the spring, or I didn't like how my swimsuit fit. And so people will come in and they'll say, I need Coolsculpting. Well, it's nice if you think about going to a provider who has more than one tool in their toolbox, because for some people, you may actually, Coolsculpting may not be your best option, that you may actually, liposuction may be a better choice, or a tummy tuck may be a better choice, or a variety of things. And so make sure that you go to someone who has the training, the experience, and multiple options, so you're not only seeing one person for one thing, but as you said, that that this time of year you can come in and talk about it, you can have something done, and then you have time with the cooler weather and being away from people a little bit to heal in a lovely sweatshirt like you have on before you get to your holiday parties, or you want to be back out in more slimmer, more fitted garb.
Absolutely. Something else that you guys offer is fillers. You know, that's something that those are treatments that, you know, people think of Botox, but there's other things too, aren't there?
Yeah, that there are a number of low downtime options that people have. We talked about the laser. Botox is more to stop little wrinkles, that people who see crow's feet or they see wrinkles on their forehead or between their eyebrows, that the Botox can help soften some of those wrinkles. But some people will feel like their cheekbones have gone down or their face is very flat and they want more fill in their cheeks. Some people will have lines around their lips, or they'll just feel like, I used to have decent lips, but now mine have sort of disappeared and I have no real thin lips or no lips, and they want just a little bit more fill. Some people, as they age, they'll think that they start having a downturned mouth or a frown, or they have deep creases in this area, and that the fillers can help soften those or help completely take them away. And the fillers will help with that as well. So between laser and Botox and fillers, that there just is a whole nice armamentarium that can really help. And there's some low downtime surgeries and some more invasive surgeries for those options as well.
Excellent. Dr. Erin Kennedy telling us all about great plastic surgery options, both surgical and non-surgical, for the off-season. One other thing we did want to touch on, Dr. Kennedy, that is something that maybe we've coined the term COVID anxiety, you know, with what's going on in the world with the pandemic. There's, you know, people are wearing masks out in public, but when they get home, they take that mask off. Maybe they're not happy with what they see under the mask.
Absolutely. That we have a lot of people who will come in, and I think everybody's very familiar that there's just this uncertainty that's going around, and how long is it going to last? Are we going to have another spike in cases? Are somebody that you know going to get very sick that was healthy, and somebody, I mean, it just is so much uncertainty that's going on. And so that there are memes that, you know, that when you have your mask on, you only have to wear eye makeup. And so it doesn't matter what this looks like, but then when you go home and you're looking at balancing the checkbook and you're looking in the mirror and you're trying to figure this all out, that there's anxiety and depression, and I can't see my friends, and we can't go to our favorite bar because it is closed or it's not closed depending on the week. And they just want something to do, you know, take some self-care. And so that it just is really nice. A lot of people are finding that they really want to do something for themselves, and they want to feel as good as they look, or they want to feel as good as they want to look as good as they used to feel and hope to feel again, and that some slight self-care, and that they want not just their eyes to look good, but they want their skin to look good, their mouth, around their mouth to look good, that just all areas. And so some small acts of self-care can go a long way.
Absolutely. Well, if people want information on any of the different things that we talked about during this, you know, sit down, they can obviously reach out to you. How do they get a hold of Dr. Erin Kennedy?
The best way is to call our office. Our office number is 563-589-9119, or visit us on Facebook at Dubuque Plastic Surgery.
All right. Dr. Kennedy, hey, we appreciate the time. Thanks for stopping in.
Thanks for inviting me.